Greetings and welcome to this conversation that I'll be having with Meg Faure, who is the founder of ParentSense. You may want to know, what is this about? For Discovery Health Medical Scheme members, they already have access to maternity benefits. These are activated by registering on the My Pregnancy and My Baby programs. So ParentSense is a new addition to broaden access to these already existing benefits. So maybe without spoiling it for you, let me ask Meg Faure to come forward and tell us, what is ParentSense about? What is this ParentSense, Meg?
ParentSense is a digital assistant that parents can use to guide them all the way through pregnancy and the first 5 years of their children's life. I'm actually a healthcare professional myself, Dr. Nolo. I'm an occupational therapist, and for many years, I've believed very strongly in the value of preventative health. In my practice, I used to see little ones, particularly in the first 3 years of their life, and we would look at things like their diet, their nutrition, their sleep, and development. But I'm only one person, and I wanted to impact so many more people. And the only way to do that is through a digital product. And that's why we developed ParentSense. We took all my body of knowledge, which includes the 8 books that I have published, including Baby Sense and Weaning Sense, and we brought all of that content and put it into an app that could put the information directly into parents' hands. What sets it apart from other digital products is that the information that's given, unlike a website, for example, is highly personalized, and it's based on data. So if a mom registers her pregnancy and her baby is born, let's say 3 weeks early, the app will actually deliver information specific to a 3-week prem baby. So the app is really, really personalized. If the mom tracks that she's breastfeeding her baby, she gets breastfeeding routines as opposed to bottle feeding advice. And so it's very focused on preventative health, but also super personalized to parents. And that's why we're so excited by this partnership with Discovery.
I am super jealous. I've got 3 kids. I never had any of this. So I think it's quite exciting. It's both for expectant mothers and also for new moms, right?
Yes, yeah, correct. So a mom registers, as she comes into the app, she registers either her stage of pregnancy or the date of her baby or toddler's birth. And based on that, the app will then personalize the journey. If she's pregnant, she will come onto a journey where she receives weekly tips about her own health, about her baby's health, and then podcasts and audios that support her all the way through her pregnancy journey. And then also courses, like, for instance, our antenatal course and our lactation course. So we really make that pregnancy journey full of preventative health content for moms. And then moving on into the baby years, we focus on the 4 main key domains of babies' lives, which is feeding, sleep, development, and health. So, for instance, in your baby's life, you'll have a vaccination chart and prompts to make sure that you do vaccinate your baby on time. You also have a recipe and meal planner functionality within the app. And that was actually developed by one of our healthcare experts, the pediatric dietitian, Kath McGaw. And that is very focused on reducing picky eating and improving allergy, so reducing the risk of allergy. So everything inside of our product is baked around making sure babies are healthy in those 4 main domains of life.
I think as much as you are focusing on, the preventative aspect of this for the baby, but it's an amazing companion for the parent, because some of us, I know, for example, with my 3 kids, my mother was far away, I was usually all by myself. So this becomes an amazing companion when I have to make those decisions as a new mom, or even, during pregnancy. So what inspired this, Meg?
Yeah, I think my base takes me back to being an OT and really wanting to invest in the early stages of life. But actually, what truly inspired it was becoming a mum myself. I'm also a mum to 3, Dr. Nolo, and I found particularly the first baby was really, really hard. I was completely out of my depth. I felt very isolated. I didn't know what I was doing, and that increased my anxiety because I was thinking, I've got this perfect little human being. I must do the best for them, but actually I'm lost. And I think a lot of moms, when they're honest, experience those emotions around, and specifically around anxiety. And so having somebody that they can kind of tap into in the moment is really, really important. One of the things that we've actually baked into the product is an AI-generated chatbot. It's very, very carefully done, and I can talk that through a bit. But what's been fascinating is that we get messages from moms at 2 o'clock in the morning. And honestly, this is a real message where a mom said to the chatbot, you are the only person I can speak to about this. And, it's those type of moments that we know we're having massive impact on people at a very isolated time in their journey.
But you know what's quite interesting, because, when you're a new mom, everyone gives advice. I mean, it's your mother-in-law, it's your friends, it's your lady next door. Everybody has got an opinion, especially a person who has gone through some, anyone who has got a child, they think that they are the best moms and therefore they can give advice. What's so important about Parent Sense? I think you've mentioned it, that, you've got specific experts that you've worked with, but I think it's important to emphasize the quality of the advice that you're getting from the app itself.
Yeah,
and from the chatbot.
Yeah, and you touch on something that's very, very important, because the reality is that parents have access to information all over the place because of our digital world. And so, you can go to Dr. Google, you can go to your friends and influencers on social media, or you can even go to regular chatbots and you can have a look for information there. The problem is that all three of those areas, the person doesn't actually know you or your child themselves. They're not basing the information on data. They're basing it on their own experience. And also it's uncurated, which means it hasn't been passed through a very careful lens where somebody's gone, is this really scientifically aligned with the World Health Organization and latest research? And that's really what sets us apart completely, because our entire team are made up of medical professionals. We have a pediatric dietitian, as I mentioned. We've got midwives, we've got nurses, we've got lactation consultants, and a pediatrician in our advisors. Every single one of our courses is created by a medical professional. So for us, having carefully curated information is very different to going and Googling something, or going and looking at TikTok and getting information that really is unjustified maybe and not scientific. So I think that in some respects, our moms of this generation are very at risk, because the information they're getting generally is not reputable very often. And so giving them something that they can rely on, because people like Discovery Health have looked into it and I have built it with medical professionals, allows parents to know that it is trustworthy.
And I think what I like about it is that, so the information is trustworthy, but also where there is a requirement for somebody to actually seek professional help, through the app, you can still guide that journey to say, maybe now you should be going and seeking professional care, isn't it?
Absolutely. And in fact, one of the things that keeps me awake is the high touch, high tech element. So we know that content can only be highly scalable if it's high tech. So digital content is highly scalable, which means we can touch hundreds of thousands of moms. The problem with that is that it's not high touch, because it doesn't necessarily have a human element in it. And so what we have really tried to bake into our product is a high touch element as well. So to take you through that, the high tech element is your baby's week or your pregnancy week that you can see on the screen. But then we've got the chatbot, which lives inside the product. The chatbot actually receives data from you as you track it and as you speak to the product. It is highly secure. None of us have access to it. It is anonymized, and it's really in a secure system. And that chatbot takes the information from my documents, which are all of my books, and the pediatrician's medical triage system, combines it with the mom's data, and then gives really, really reputable advice. So we're able to take this care up to a more high touch level through the chatbot, and moms can access that 24/7. And then we even take it further. And one of the things that, for instance, that we've done with Discovery Health is that we have a questionnaire that a mom can complete anonymously in pregnancy around postnatal depression, as an example, which interestingly can actually arise in pregnancy. And the mom then gets flagged anonymously. Again, we don't share the data, but we then give an automated response to say, you've got a benefit that you need to take care of, that will take care of your mental health. Please use your benefit. So we really do tie in everything that we see about the mom into something that's high touch that Discovery would then offer.
Oh, this is really great. I mean, now we've said our members have got access to existing benefits. This becomes just an add-on, and it's great support for mothers. And I think, I mean, when we think about the anxiety that comes with being a new mom, not knowing what to do, this really tries it really brings an additional level of support that eases that anxiety and also that pressure that comes with being a new mom. And I think also being pregnant, I mean, we always are fearful of what could happen to us and to our babies, our unborn babies. So this is really an important, tool to assist those mothers who are going through this journey. And I think for those who are on Discovery Health Medical Scheme, they get access to these amazing tools at no additional cost. So we are really excited, Meg. And I think we're really excited about the work that you're doing and you continue to do. And I'm sure you will continue to add additional features that will make this even better for those mothers who are engaging with this platform. So maybe as a closing remark from your side, what are the key things that you think mothers should be looking out for when they are engaging with the app?
Yeah, look, I think they must definitely look out for Aya, the chatbot. She is quite remarkable. As I said, she has a medical triage system built into her. So that means that if you ask a question that looks like you should be seeking medical advice, she'll immediately tell you based on our pediatrician's advice in it. And she's there 24/7. So ask your questions, engage with her, and really use her kind of in those late night hours before you need to go through and kind of speak to a doctor. So that's the first thing I would do. We also have monthly webinars that are available free of charge to Discovery Health members. Our one last month was on immunity through winter. We've got one coming up that's on getting your baby to sleep through the night. So join us on those. And then use the feeding section of the app to help you with weaning, because you then will be able to get a meal plan, recipes. So there's just so much inside the app that will support you on your parenting journey.
So Meg, tell me, what are the kind of questions that moms and both expectant and also new moms ask our chatbot?
Yeah, so they ask lots of questions, mainly around sleep and feeding and development. Those are kind of the three kind of hot topics. So how long should my baby's naps be? Or can you give me a routine for my baby for tomorrow? Those are quite common. And we get a lot around express breast milk. How do I express milk for my baby? And how many mils must I feed my baby? And then the chatbot will then know the baby's age and will tell the mom the answer to that question. Another great question that parents should ask is, give me an activity for my nanny to do with my baby tomorrow. And the chatbot will know. Great. It's amazing. The chatbot will know your baby's age and give you some lovely activities. And then when you get onto the more medical and health related questions, because we've got a medical triage system built in, if it looks like something that's a really not a problem of a question, like for instance, my baby has a bit of a snotty nose, how can I clear their nose when I'm breastfeeding them, as an example? The chatbot will answer that, because there's some lovely little responses that you can give around, saline spray and so on. But if you ask a question like, my baby is 6 weeks old and has a temperature of 39 degrees, the chatbot medical triage system actually kicks in, and the chatbot will not answer the question. What it'll say is, you need to get your baby to the doctor immediately. And so we've kind of built in the system where the chatbot knows what is medically sensitive and will then immediately refer you into some sort of emergency program or back to your pediatrician. So it's really sensitive.
That is great. No, that is really great. So this is just for everyday support. It does not replace, your clinician in terms of emergencies. So we're still encouraging people to follow the emergency route where, there are real healthcare problems. But here, it is really for that, everyday support. No, thank you so much. And I think maybe just to also highlight that for people to have access to this amazing tool, they have to register on the My Pregnancy, program, and also My Baby program, specifically for those people with children under the age of 1. So it is really an amazing addition to our benefits, and we are really excited about it. So thank you so much again, Meg.
Thank you, Dr. Nolo.